So, hi guys, welcome for the KNO classes. This is your Nagraj, your NORCET mentor and NORCET guide. So we are in the MCQ series. Okay, for NORCET 10. Okay, we are targeting the like high yield MCQs. Okay, along with the rapid revision. Okay, so we are including all subject. Okay, include all MCQs. So we are dealing the all MCQs with the four options analysis. Okay, how we are choosing the right answer, how we can eliminate the a wrong answer. Okay, so analysis. So one MCQ is equal to four MCQs. So I will be explaining a whole all MCQs. Okay, why it is right, why it is wrong. Okay, so without delay, okay, we'll directly go to toward the session. Okay, first question of the session is okay in front of you here. So I'll read out the question. Okay, from the community. Okay, from the community. Okay, see here nowadays. Okay, they are asking regarding the MCQs. Okay, regarding the all national programs. Okay, all national programs and the so along with the symbols, okay, you should be perfect. Okay, you should be perfect. Okay, if you see the just image of the this image of the symbol, okay, you should be able to answer the which program it is. Okay, which program it is. Okay, and you should know the program. Okay, some target points will be there. Okay, some cardinal points will be there. You should be aware of that important point regarding the program. Okay. Here I'll read out the first question. Okay, here we're having the first question. Which of the following? Okay, which of the following is correct statement. Okay, it's which of the following is the correct statement with respect to the given below national health program. Okay, national health program. Here the examiner is asking you the according to the given below image. Okay, which health national program is the correct statement. Okay, first we have to identify the image, then we will go towards the options. Okay. So, everybody's does anybody knows okay which one is this given image is of program is of. So you can see okay here the children's okay here the children's with the uniform. Okay, they are sitting with the plate. Okay, they are sitting with the plates. Okay, these are the plates around. Okay, around they are sitting with the plates with the blue uniform. Okay, with the blue uniform. Okay, so it shows that okay it's a school health program. Okay, we can say it is a school program. Okay, it is a school program. In that school program, okay, you should answer it. Okay, you should know it. So along with the plate means okay in school. So which program will come with the plate? So that is your school midday meal program. Okay, it is a midday meal program. Okay, we can say it is a midday meal program. Okay. So, first of all, it is started with the Kamraj Salai. Okay, it is started in the Tamil Nadu. Okay, Tamil Nadu first and foremost thing. It is started in the Tamil Nadu. Okay, to encourage the school-going children. Okay, to encourage the school dropout students, especially if you're giving the lunch. Okay, they will almost okay. Those will go for the government schools. They will be deprived of food. Okay, food. So food will not be there in their home. So what will happen? So if you give the food, okay, the automatically the students will come to the school for a food sake also. So that to encourage the school for admission, the government school for admission, and to encourage the dropout students to come for the school, they started with the midday meal program. Means in that program, okay, they'll give a one meal. Okay, one meal is given. Okay, one meal is served for the every students in a government school and the government added schools. Okay, we can say government school and government added schools. They will give a one hot served meals. Okay, according to the midday meal program. Okay. So it's so first steps. Okay, first step in the question is okay. We solved we got to know okay which program it is. Okay, it is a midday meal program. So before nowadays we are calling this one as midday meal program because before it is called as PM Poshan Abhiyan. Okay, PM Poshan Abhiyan, PM Poshan program. Okay. So we'll see. Okay, first we call this one as the PM Poshan Abhiyan. Okay, PM Poshan Abhiyan. Okay, PM Poshan Abhiyan. So now it is okay. Now it is named as midday meal program. Okay, we termed as midday meal program. Okay, midday meal program. Whom they will give a food? So they will give a food for government schools. Okay, one hot served meal given for the government schools. Okay, government school and and added. Okay, government added. We can say government added schools. Okay, both schools they are giving a government added schools. They are giving the hot served one meal for every student. Okay, one meal for every student. Okay, here we got to know okay which health which national program it is. Okay, now we'll see the options. Okay, now we'll see the options. So first option is okay. It is a central sector scheme implemented by the Ministry of the Women and Child Development. Okay, Women and Ministry of okay. So Ministry of Women and Child Development. Okay. Option B is like first. Okay. First I told you. Okay. First we have to identify the national program. Okay. We identify the national program. It is a school health program. That is your midday meal program. Okay. Now we'll see which is correct statement given for the midday meal program. Okay. First one I told you it is a central sector scheme, okay, implemented by the Ministry of Women and Child Development. Okay, option number B is this scheme provides one hot cooked meal for preschool children, and in addition to the 1 to 8 standards children. Okay, 1 to 8 standards children means nothing but the pre-primary, okay, preschool, okay, pre-primary and upper class, okay, upper class students. Okay, option number C is under this program. Under this scheme, okay, 700 calories and 40-gram proteins for the upper class children's upper class and primary children. Okay, option number D is it emphasizes on the nutritional status among the adolescents women. Okay, this four other options. Okay, you have to choose the perfect, okay, correct statement for the midday meal program. Okay, for the midday meal program. So just answer it in the comment section. Okay, I'm waiting for your answers. Okay, I'm waiting for answers. So answer rightly, okay, and along with the rationale, you should know the why we are writing it, okay, why we are giving it, okay. So first and foremost thing, okay, first I will go with the answer. Just see, okay, like midday meal program under I told you, okay, under midday meal program, okay, they will give this target, okay, this program target population is they're targeting, okay, they're targeting on the preschool childrens, okay, preschool and school going, okay, in school, okay, in school going children's, okay, it's included upper primary and middle primary, okay, upper primary and lower primary, sorry, upper primary and lower primary, lower primary, and that is your class starting with the first to 8 standard, okay, first to 8 standard population children are included in midday meal program, okay, in midday meal program they added, okay, they included the lower and they specially include lower and upper primary students, okay, upper primary students are included, okay, upper primary students are included in the midday meal program, okay. For this program, okay, from the program, okay, from the midday meal program they'll give a hot, okay, hot cooked one meal, okay, one meal is given, okay, one meal is given for the every students, okay, for every student they'll give a one hot cooked meal they given, okay, meal they're going to give by the midday meal program, okay. From this program, okay, from this program they will give a so how much calories? Okay, should focus on calories. Okay, how much calories it provides? It provides the for lower primary school children. Okay, for lower primary school children. Okay, they will give a 450 kilocalories. Okay, 450 kilocalories of calories are given, and the and 12 gram protein. Okay, 12 gram protein given. Okay, 12 gram protein. Okay, 450 kilocalories they given. Okay, calories they'll give, and 12 gram protein they will give. Okay, and for upper primary school, okay, for upper primary schools, okay, for upper schools, okay, for upper primary school childrens, okay, they will give a double calories, okay, 700 kilocalories because the need will be more, and 20 gram protein, okay, and 20 gram protein is given, okay, protein is given by the midday meal program, okay. And if you see for a lower primary school children, okay, for lower primary school children, they will give a 100 gram, okay, 100 gram food grains, okay, food grains to meet the protein, okay, food grains are given by the midday meal program, and upper primary school children, okay, and upper primary school children they will give a 150 grams, okay, 150 gram food grains are given, okay, food grains are given because they will be on the children school going children will be in the development phase, they require some more protein and more calories, okay, from this program, okay, this and all is given, okay. So we have to see the correct statement for midday meal program. Okay, we have to see the correct statement. Okay, correct statement you can see. So this the option number B is the right one. Okay, this program. Okay, this scheme will provide the one hot cooked meal for preschool. Okay, preschool children means starting from the 3 years. Okay, starting from the 3 years to the 3 years to the 14, okay, 14, sorry, 15 year, okay, for 15-year children are and target population for the midday meal program, okay. In addition to the preschool, along with the, in addition to the class 1 to 8 student, okay, school going children, okay, school going children, okay, this is the main target population of the of the midday meal scheme, okay. So we know that, okay, it gives the only 450 calories, okay, 450 calories for the preschoolers, nothing but the like lower, okay, say lower school children, okay, lower primary school children, okay, and 12 gram protein only. But here they written a 700 calories and 40 gram protein. So this is not the right answer. So it emphasizes on only, it not only emphasizes on only adolescent women, okay, it emphasizes all the boys and females, okay. So we know that, okay, it is centrally sponsored program. Okay, we know that it is a centrally sponsored program, but it is not like, it is not administered with the Ministry of Women and Child Health Development. So which ministry it will come? So which ministry it will come? Midday meal program. Does anybody know that? Okay, does anybody knows which ministry is going to handle the midday meal program? Okay, so especially if you see, because it is school health program, I told it is a central sponsor. It is central sponsor only. It is a central sector scheme, but okay, but handled by the local body. Okay, local bodies they will handle. So it comes under the Ministry of. It comes under the Ministry of. Since it is a school program, okay, it comes under the Ministry of Education. Okay, Ministry of Education. Okay, Ministry of Education is going to handle the midday meal program. Okay, midday meal program. So from this ministry, okay, so so under this ministry, okay, Sarva Shikshana Abhiyana, okay, is going to handle the Sarva Shikshana Abhiyana, okay, Sarva Shikshana Abhiyana, okay, Sarva Shikshana Abhiyana, okay, under this program, okay, under this project, okay, under this program only, the midday meal is provided, okay, under this program only, midday meal is provided, okay, midday meal is provided. Sarva Shikshana Abhiyana. Okay. Just keep in mind that, okay, it is not a, and it is not come under the Ministry of Health and Ministry of Women and Child Development. Okay, it comes under the Ministry of Education. Okay. So option number B is the right one. Okay, the option number B is the right answer. Keep in mind that, okay, it provides the one hot served cooked meal for a preschool children in addition to the class 1 to the 8 students. Okay. All of you clear? Okay, first question, all of you clear? So we'll move towards the second question. Okay. So this is from the OG. Okay, this second question is from OG. So if just read out the question. Here we are having a 24-year female presented to the clinic with the urinary dribbling from the vagina. Okay, here there is a like young lady came to the clinic. Okay, came to the clinic with a history. Okay, with the complaints of urinary dribbling from the vagina and had a history. Okay, and history before if you ask the history, like antenatal history, postnatal history. Okay, during delivery history. So if you ask means she will tell the history of prolonged labor. Okay, prolonged labor for 5 months ago. She had delivered a baby 5 months ago, and it's a prolonged delivery. Okay, it's a prolonged delivery. Okay, which one is given among the most common type of fistula seen in this case? So they're asking you the due to the obstructed labor. Okay, due to the obstructed labor. Okay, obstructed labor nothing but a prolonged labor. Okay, due to the obstructed labor or due to the prolonged labor. Okay, due to the prolonged labor, we can say prolonged labor nothing but a like or else emergency sorry traumatic labor we can say. So you can say like it's in the traumatic labor, okay, obstructive labor, okay, all is the same, okay, traumatic labor, okay, this all traumatic labor, okay, traumatic labor, okay, due to the prolonged labor, obstructed labor, or a traumatic labor, okay, which is the most common genitourinary fistula is seen in this case, okay, genitourinary fistula is seen in this case, okay, this is your question. So option number A is ureterovaginal fistula. Option number B is uretero, okay, uretero, and uretero, okay, uretero vaginal fistula. Option C is vesico-vaginal. Okay, vesico-vaginal fistula. Option number D is a recto-vaginal. Okay, option number D is a recto-vaginal fistula. Okay, okay, just try to put your comments in the comment section. Okay, comments in the comment section. So I'm waiting for your response. Okay, try to analyze the question. Okay, try to see. It's almost like it's a knowledge-based question only. You should read it, then only how you will get the answer. Okay, so which is the right answer here? So here is a 24. I read it one more time. Okay, 24-year female present with the OPD with urinary dribbling from the vagina and had a history of prolonged labor 5 months ago. Which one among the given is most common type of fistula in this case? Okay, try to answer. I'm waiting for your answer. I'm waiting for your answers. See here. Okay, here is topic. Okay, genito urinary fistula. Okay, genito urinary fistula. So probably, okay, most probably, okay, due to the labor, okay, we knows that, okay, due to the labor, okay, due to the obstructed delivery, okay, this all is case, okay. So what will happen? So all is case, okay, there will be pressure, okay, there will be pressure on the genital urinary tract, okay. When the labor, okay, when the female is about to deliver the baby, that time what will happen? There will be increased intrapelvic and increased abdominal pressure. So if we put a more pressure on the genital urinary organs, so there will be a chance to have a abnormal connection. Okay, abnormal connection here. The genitourinary fistula nothing but it's a abnormal connection. Okay, abnormal connection between the different organs. Okay, abnormal connection between two different organs. Okay, two different organs. Okay, two different parts of the body. We can say two different parts of the body is called as genitourinary fistula. So what will happen? So mainly if you see the options. So if you see the options, okay, urethro and uretero. Okay, so here what will happen? I will draw the diagram. Just you see, if this one is a female, okay, vestibule, okay, it's if consider if this one is female vestibule, what will happen? So mainly two openings will be there. Okay, two openings. Okay, here there will be a just here there will be a clitoris will be there. Okay, here there will be a clitoris, and just to the below the clitoris there will be a urethra. Okay, there will be a urethra. And below urethra there'll be a vagina. Okay, there'll be a vagina. Okay, this one is sorry, this one is your urethral meatus. We can say urethral meatus, nothing but a opening. Okay, opening of the urethra, and this one is your vaginal opening. Okay, this one is your vaginal opening. Okay, we can say vaginal orifice or vaginal opening. So what will happen due to the so like delivery, we know that okay, the baby will be coming from the vagina. So there'll be a lot of pressure. Okay, there'll be a lot of pressure on the urethra. Okay, on the urethra. So there'll be a connection between the urethra and the vagina. Is called as urethro. Okay, urethro vaginal fistula. We call that one as the urethro vaginal fistula. So I'll write down the all options here with the just here see. Okay, there's a term called as urethro. Okay, urethro vaginal fistula. Okay, urethro vaginal fistula. Urethro vaginal fistula. So urethro vaginal fistula nothing but okay, there will be connection between the urethra and vagina. Okay, there will be a connection between the urethra and vagina. Okay, that's your urethro vaginal fistula. Okay, and then uretero. Okay, uretero-vaginal fistula. Uretero, nothing but here there will be a connection between the ureter, okay, ureter and the vagina. Okay, vaginal connection will be there. Okay, vagina both are having the connection. Okay, that's your uretero and vaginal fistula. Okay, third one is that is your vesico-vaginal fistula. Okay, vesico-vaginal fistula. Okay. Vaginal fistula. Here there will be connection between the bladder, okay, between the bladder and the vagina of the body, okay. Both will be connected together. So that connection, okay, especially like connection between the bladder and okay, connection between the bladder plus vagina, okay, bladder plus vagina. There'll be a abnormal connection, okay, there'll be a abnormal connection. Just you see in bladder what will be there, okay, in bladder there'll be a in bladder there'll be a urine, okay, there'll be a urine. So we know that, okay, urine will be there in the bladder. So if there's a connection between the urine, bladder and vagina, what will happen? There'll be continuous, okay, there'll be a continuous. So the urine will not stop, the urine will be continuously dribbling, okay, continuously will be dribbling, from the vagina, okay, from the vagina, okay, that is what your, like, if you see, oh, like, what will happen? So, like, at the last trimester, okay, at the last trimester, okay, at last trimester, okay, at last trimester, what will happen? At the last trimester, okay, at the delivery time, okay, at the delivery time, what will happen? Your female, okay, that gravida, okay, we can say that gravida, okay, that will become that gravida will become that will become the pelvic part, okay, that will become the pelvic gravid uterus, okay, gravid uterus became will become the pelvic organ, okay, that will become the pelvic organ. We know that, okay, in pelvic, okay, along with the gravid uterus, okay, there'll be a bladder, okay, there'll be a bladder present. So if there is any obstructed labor, okay, so that all obstructed labor, we can say obstructed labor, or a traumatic labor, okay, or the prolonged labor, okay, that will create a pressure on the bladder, so that will cause the abnormal connection, okay, that will cause the abnormal connection between the bladder and the bladder and vagina, okay, bladder and vagina, okay, that's why there'll be a vesico-vaginal fistula is more common in a obstructed labor or a prolonged labor, okay. And last option is, that is your recto vaginal fistula, okay, recto vaginal fistula. We know that, okay, recto means nothing but as name still says there, okay, recto nothing but a rectum, okay. Here there is a connection between the rectum plus vagina, okay, rectum plus vagina, there'll be a connection, okay, they'll be abnormally connected, okay, abnormally connected. It is the least, we can say, recto-vaginal fistula is the least common variety, okay, least common variety of the fistulas, okay, it is the least common, we can say it is the least common fistula, okay, least common fistula. So here what will happen, due to the connection between the rectum and the vagina? In rectum, what will be there? There will be a feces. Okay, so there will be a feces coming out from the vagina. Okay, in case of rectovaginal fistula, what will happen? There will be feces coming out from the vagina. Okay, vagina. So instead of urine, here there will be a feces will be coming out from the vagina. Okay, if all of you clear, okay. So right answer is your right answer is Vesico-vaginal fistula. Okay, vesico-vaginal fistula. Because I told you why it is the right answer. Because like I told you, gravity uterus will become the pelvic organ in the last trimester. Okay, at the delivery time, okay, that will become the pelvic organ when the fetal head will descend into the pelvic inlet. So that will be called as like pelvic organ. Okay, it will become the pelvic organ. Okay, gravity uterus fetal head will become the part of the pelvic organ. So there will be a more pressure exerted on the bladder. So in case of obstructed labor, in case of prolonged labor, it will have a trauma. It will have a connection between the bladder and the vagina. Okay, that's the most common type of fistula given seen in case of obstructed labor. Okay, all of you clear? If you clear, we'll go with the third question. Okay, here we're having the from psychiatry. Okay, from psychiatry, I picked up one question here. You can see here we are having the So a 25-year-old, okay, man admitted in a psychiatric ward with the disorientation, okay, confusion, and he describes, okay, when he looks in the mirror, he cannot see his own reflection. Okay, so this phenomena is known as, okay. Here is from psychiatry. I picked the question. Okay, here is a one. Okay, 25-year-old came to the psychiatric ward. Okay, sorry, admitted in psychiatric ward with the complaints, okay, with the complaints of disorientation to the place, person, on the time, okay, disoriented to the place, person, time, and along with the confusion, okay, he's not having the clarity of thoughts, he's having the confusion, okay. So if you ask his name, okay, he'll be confused, okay, he'll be telling something, blah 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 blah. So he describes, okay, when he asked him, okay, he describes that, okay, when he looks in the mirror, okay, when he looks in the mirror, he cannot able to see his own reflection, okay, he's cannot able to see his own reflection, okay. This phenomena is called as, okay, this phenomena is known as. So option number A is negative endoscopy. Option number B is internal endoscopy. Option number C is hypnagogic hallucination. Option number D is extra campaign hallucination. Okay, extra campaign hallucination. Okay. Does anybody knows? Okay, I'm waiting for your answers. Okay, I'm waiting for your answers. Just try to put your answer in a comment section. So that is your like first question is negative endoscopy. Second option is internal endoscopy. Option number C is hypnagogic. Okay, hypnagogic hallucination. Option number D is extra campaign hallucination. Okay, this so I'll explain. Okay, all options here. Just see. So first one. Okay, first time I told you. Okay, it is a negative. What do you mean by negative? Negative endoscopy. Okay, negative endoscopy. Negative. Okay, negative endoscopy. We know that okay, negative endoscopy nothing but a. So, like, does anybody knows that? Okay, what do you mean by phantom limb? Okay, it is opposite to the phantom limb. Okay, phantom limb, what will happen? So, in a phantom limb, so in a phantom limb, okay, the person will not having the any limb. Okay, will not having the any limb will not be there. Okay, the limb will be amputated, but he can okay, but he can perceive. Okay, the person can perceive the limb present. Okay, present on the on his reflection. Okay, he can reflect his limb. Okay, he can reflect his limb. Okay, which is not there. Okay, which is not there in case of, especially in case of ebony amputation. Okay, and the ebony amputation, amputation, what will happen? The person's limbs will not be there. Okay, they'll be cut down, but he can able to perceive the limb is present. Okay, that is what we call as a phantom limb. Okay, phantom limb. But here, what will happen? So here, what will happen? The person, okay, the already the person is having the already he will be having the limbs. Okay, limb will be there, or else he will be having the body parts. Okay, body parts will be there. Body parts will be there, will be present. Okay, will be present, but he cannot able to see. But he cannot able to reflect. Okay, he cannot able to reflect. Okay, can't able to reflect the he cannot able to reflect his own body parts. Okay, his own body parts. Okay, that is what we call as negative Autoscopy. Okay, negative. Okay, negative nothing but there is absence. Okay, there is absence of a body part. Okay, auto means self. Okay, self scopy means seeing. Okay, visualization. So nothing but we hear the person will not hear. Here he will not perceive. He will not perceive. He will not perceive his own. Okay, his own body parts. Okay, his own body parts. His own body parts. Okay, that's what we call as negative autoscopy. So if we see the options, okay, negative autoscopy is the right answer. Okay, negative autoscopy is the means here the person is describing when he looks in the mirror, he cannot able to see his own reflection. Okay, he's not able to see the his own reflection. That's what we call as negative autoscopy. Okay, negative autoscopy. Then what do you mean by internal autoscopy? What do you mean by internal autoscopy? You can see here, okay, internal autoscopy. The term is called as internal. Okay, internal means inside. Okay, internal autoscopy. Okay, internal or inside. Okay, autoscopy means here the personal. Okay, here the person can able to see his own body parts. Okay, his own body parts. Here he can able to perceive. Okay, the person can able to perceive the his own body parts. Okay, so has name itself is there. Okay, inside means okay the person able to perceive here in this question. Okay, the person can able to perceive. Okay, can able to perceive perceive or visualize. Okay, we can say two terms we can use. Okay, you can able to perceive or you can able to visualize the his own. Okay, his own internal organ. Okay, his own internal organs of the body. Okay, internal organs of the body, that's what we call as internal internal autoscopy. Okay, internal autoscopy. And then one, okay, then third option is that is your hypnagogic. Okay, hypnagogic. Okay, hypnagogic hallucination. Okay, hallucination. Hypnagogic hallucinations. Okay, Here what will happen? Okay, hypnagogic. Okay, two terms are there. Okay, hypnagogic and hypnopopic. Okay, hypnopopic. Okay, two terms are there. You can see here, okay, hypnagogic, okay, G is there, okay, G nothing but a going, okay, going, G, just you remind like that, hypnagogic nothing but a going, okay, before going, okay, where going, before going to the sleep, okay, before going to the, before going to the sleep, okay, before going to the sleep, you will, what you'll have the abnormal sensation, okay, you'll have the abnormal sensory perception, okay, abnormal sensory perception will be there, okay, abnormal sensory perception will be there, okay, like an examples like a vivid kind of dreams, okay, vivid kind of dreams will be there, okay, that's all called as, okay, that's what we call as abnormal sensory perception, nothing but a hallucination, okay, will be there, like vivid dreams will be there, okay, that will be there before going to the sleep, means from the awakeful to the sleepness, okay, awakeful to the sleepness stage, okay, that transition phase, okay, from when you go on the bed, okay, we'll try to sleep from awakefulness to the sleep stage, okay, that what transition phase will be there, in between you will have the abnormal sensory perception will be there, okay, vivid kind of dreams will be there, that's all called as hypnagogic hallucination, okay, that's all called as hypnagogic hallucination, okay, all of you clear what do you mean by hypnagogic hallucination? Okay, then we'll see. So here the hypnogogic also came. So I'll clear that with the hypnopopic hallucination. Okay, hypnopopic hallucination. Hypnagogic and hypnopopic. Hypnopopic. Okay, hypnopopic hallucination. Okay, these all are the types. Okay, different special type of the hallucination. Okay, special type of hallucination. Okay, here what will happen? P. Okay, P for the post sleep. Okay, P for the, just remember like that. Okay, P for the P word is there. Okay, hypnopopic. P for the post sleep. Okay, post sleep. You can say post sleep, nothing but a when the person will awake, okay, from the in between the stage of, okay, sleep to the awakefulness, okay, sleep to the awakefulness means now I'm on the bed, okay, I'm sleeping, okay, I slept for the 6 hours, 7 hours, okay, now I'm about to wake up, okay, I'm about to wake up in the transition phase, in the transition phase, okay, in the transition phase, if you are having the abnormal sensory perception, okay, if you are having the abnormal sensory perception, okay, abnormal sensory perception, okay, in the transition phase, if you're having the abnormal sensory perception, okay, abnormal sensory perception is having means, okay, vivid kind of dream is there, we call that one as hypnopopic, okay, hypnopopic hallucination, okay, that is your hypnopopic hallucination, okay, and option number D is extra campaign hallucination, okay, extra campaign hallucination, okay, extra, here the word is there, okay, extra plus campaign, okay, extra plus campaign. Why I'm splitting and writing? Okay, it will be very easy to understand. If you know the word, okay, if you split the word and understand, it will be very easy for you. Okay, extra campaign hallucination. Okay, extra campaign hallucination. So what do you mean by extra campaign hallucination? Does anybody knows it? So just I'll explain. Let me. Okay. So here you can see. Okay, extra campaign. Okay, extra campaign. Nothing but a extra camp. Okay, extra camp means away, okay, it's away, okay, it's outside the, okay, it's outside the sensory field, okay, outside the sensory field, outside the sensory field, if you perceive something means, that's what we call as extra campaign hallucination, okay, I'll give you example, okay, you will feel, okay, the person is, okay, person is talking behind you, okay, talking or the standing behind you, okay, standing behind you, okay, standing behind you, okay, behind your sensory perception, okay, behind you, where there is no, okay, where there is actually no one is there, okay, actually there is no one is present, okay, when actually there is no one is present, that time you'll feel somebody is talking behind you, okay, somebody is standing behind you, but if you see, so nobody will be there, okay, in the sensory field, outside sensory field, nobody will be there, okay, that's what we call as extra campaign hallucination, okay, extra campaign hallucination, okay, if you clear, all of you clear what you mean by hypnagogic, hypnopopic, and the extra campaign hallucination is, okay, then we'll move towards the, so option number A is a right answer, okay, negative autoscopy. Here what will happen, the person will not able to perceive his own body parts, okay, when he cannot able to reflect his own body parts, okay, that's what we call as negative autoscopy, okay, and then Next, fourth question. Okay, this is also from psychiatry. Here you can see, I'll read out the question. Here we're having the 58-year-old male present to the psychiatric OPD with the complaints of not taking food for the past 2 weeks. Okay, past 2 weeks. And if you ask him, okay, when if you ask it about it, okay, why you are not having food? Okay, means he explains that. Okay, patient will explain that his intestine doesn't exist. Okay, his intestine doesn't exist. Okay, doesn't exist. So how can I eat? Okay, he'll reply like that. Okay, if you ask why you are not having food, he will explain it. Okay, my intestine is only not exist. How I can eat like that? He will explain. Okay, so he's expressing along with he is experiencing low mood, unstable. Okay, unable to sleep. Okay, unable to sleep. Okay, along with this complaint. Okay, means he's not having food for 2 weeks, and he says if you ask you why you are not having, he will say my intestine doesn't exist. Okay, how I can eat? Okay, and along with that he's having a low mood, okay, and unable to sleep, okay, means he's in depression now, okay. Based on a scenario, explain the content, okay, explain the content of the delusions, okay. We knows that, okay, delusion nothing but a, everybody knows that, okay, delusion nothing but a, it is a false, okay, it is a false, it's a false, we can, so here also the person having the false belief of he is not having the intestine, okay. So in the delusion, okay, delusion nothing but a false fixed delusion nothing but a false fixed personal belief. Okay, personal beliefs will be there. Okay, personal beliefs will be there. Okay, personal belief will be there. Okay, that's what we call as a delusion. Okay, so here the examiner asking you which content. Okay, which content of the delusion is having. Okay, which content of the delusion is having. Okay, so option number A. Okay, option number A is okay more incongruent with the nihilistic delusion. Okay, with the nihilistic delusion. Okay, option number B is more incongruent with the nihilistic delusion. Okay, option number C is more congruent with the Cotard syndrome. Okay, Cotard syndrome. Okay, option number D is more incongruent with the Cotard syndrome. Okay, so which option is right among the given options? Okay, try to put your comment answer in the comment section. Okay, so I'll explain you regarding the nihilistic and Cotard syndrome. Okay, here you can see. Okay, one broad category is there. Okay, one psychiatric disorder, that is your Cotard syndrome. Okay, Cotard syndrome. Cotard syndrome. What will happen in Cotard syndrome? Cotard syndrome. Okay, the person will not have any sensory perception of leaving. Okay, he will say the person will not have a feeling of, okay, he will say, the person will say word is not there. Okay, word doesn't exist. Okay, the word doesn't exist. Okay, word doesn't exist. And okay, he'll say I'm already dead. Okay, he'll say I'm already dead. Okay, he'll say I'm already dead. Okay, I'm already dead. Okay, my body parts doesn't exist. Okay, he will say my body part doesn't exist. Okay, doesn't exist. Doesn't exist. Okay, he'll say I'm already dead. Okay, in Cotard syndrome, okay, it's a collective syndrome. Okay, it's a collective syndrome where the person will not have any feeling of body parts is not there. Okay, the word is not exist. Okay, that's all perception will be there. Okay, that all fixed personal belief will be there. Okay, especially the person will feel a will not feel any body parts. Okay, I'm not lying. Okay, I'm not living. Okay, I'm already dead. Okay, my body parts is not there. Like that, he will say. So they falsely firmly believes that okay, that body part is not exist, okay, not exist. So in that only, okay, in that only, so nihilistic delusion is the nihilistic, sorry. So in Cotard syndrome only, you'll have the symptoms called as nihilistic delusion, okay, nihilistic delusion, okay, nihilistic delusion is the one of the symptom, okay, it's a part of Cotard syndrome, okay, it's a parts of Cotard syndrome. Okay, Cotard syndrome. So what will happen in nihilistic delusion? Okay, nihilistic delusion, the person will falsely. Okay, will can say can he'll falsely believe that. Okay, he'll falsely believe that. Okay, believe that his own body parts. Okay, his own body parts doesn't exist. Okay, doesn't exist, like that he will say. Okay, in nihilistic delusion, the person falsely believes that okay, his own body parts doesn't exist. Okay, that's your nihilistic delusion. Okay, it's a part of Cotard syndrome. We can say it's a part of Cotard syndrome. So then what do you mean by nihilistic delusion? Nothing but a the person, okay, the person falsely believes that his own body part doesn't exist. Okay, that is your nihilistic delusion. Okay, then you can see, okay, what do you mean by congruent and what do you mean by incongruent? What do you mean by congruent and what do you mean by congruent mode and incongruent mode? Okay. So in mode, okay, there are special two type of modes are there. Okay, modes. So mode can be two types. Okay, mode can be a two type. First one I told you congruent mode, congruent, congruent mode and incongruent. Okay, congruent and incongruent mode. Okay, two terms are there, congruent and incongruent mode. Okay, congruent mode and incongruent mode. Okay, two are there. Okay, two are there. Two modes are there, congruent mode and incongruent mode. Okay, you can see here. Okay, in congruent mode, the person will have a appropriate. We can say appropriate mode. We can say appropriate mode. Okay, congruent mode can be called as appropriate mode. Means if the person is having the if in a thoughts. Okay, in the thoughts he is having thoughts of if he's having the thoughts or thinking of good, okay, thinking of good, he'll be having the good mood, okay, good thinking is there, okay, good thinking is there. That time he will feel, okay, he will feel also good, okay, he will feel also good. So if he's having the thinking, okay, thoughts of good thinking, good ideas are there, he'll feel good, okay, he'll feel good. But in an incongruent mode, okay, incongruent mode, what will happen? We can say inappropriate, okay, it's a inappropriate. It's an inappropriate mode, we can say, okay, inappropriate mode. So if he's having the thoughts of, normally if he's having thoughts of good, if thoughts are good, okay, if he's having the thinking of good, but he will behave, okay, he'll feel, okay, he'll behave in a opposite manner, okay, he'll feel in a opposite manner, he'll feel sad, okay, he'll feel sad or a bad, we can say, he'll feel bad, okay. See, just I'm having, I'll give you an example for congruent mode, okay. Now I'm having the thoughts of like feeling happy, I'm achieved something means I'll feel good, okay. Today I'll be living, okay, smiling with a smiling, I'll talking with everyone, okay. I'll talk with everyone with a freely smiling and all. That's what we call as congruent mode. Okay, means I'm having the something I'm achieved. Okay, some thoughts, good thoughts I'm having means I'll feel like good. Okay, but in case of incongruent mode, okay, if having the good thoughts, okay, I'm already achieved something. Okay, done something, but I'll feel sad. I'll feel low like that. Okay, means that is what we call as incongruent mode. Okay, incongruent mode. Okay. So we'll go with the question now. We'll go back to the question now. Here the person is having the. I told you he's not having the food. Okay. After that he'll say my intestine doesn't exist means it is a part of okay it's a part of nihilistic delusion, okay, it's a part of means my own body part is not existing, nothing but a it's a nihilistic, okay, it's a nihilistic delusion, okay, and he is experiencing the low mode, okay, low mode nothing but a low mood and unstable sleep means the person is already in depression because he's not having the food, that's why he's telling. So along with the mood, okay, he's having the same low mood, okay, unable to sleep, okay, depression is there means he's having the congruent mode, okay, it's having the congruent mode, okay, it means something but inappropriate mode is having, okay, that's your option number A is the right one, okay, a mode congruent with the nihilistic delusion. So option number A is the right one, okay, option number A is the right one, okay. This one is previously asked in the your FMGE question, okay, previously asked in your FMGE question, okay. So this is your question number 4. Okay, now we'll go with the question number 5. Okay, question number 5. Here I'm having the which like simple question. Okay, simple question from the psychiatry. Which among the given following is the statement describes about the formication? Okay, option number A is the feeling of small insects. Okay, crawling on the body. We're crawling on the body parts. We're crawling on the body parts. And option number B is okay, feeling of limbs. Okay, being moved. Okay, feeling of the limbs being moved. Option number C is option number C is option number C is feeling of floating. Option number D is a pricking sensation. Okay, just very easy question. Okay, it's from like a psychiatry. I told you like here the person is having the here the best statement to describe the formation. Okay, formation nothing but I told you okay, option number A is right answer. Very easy question. Feeling of small insects crawling on the body. Okay, we can okay, also say it's an cocaine bug. Okay, it's also called as cocaine bug. Okay, cocaine bug. In case of substance abuse. Okay, in case of substance abuse, okay, those who are having the substance abuse disorder, okay, substance abuse disorder, especially those who will eat the cocaine, those who will take a cocaine, they will be having the cocaine bug, nothing but a formication will be there. Okay, substance abuse case. In case of substance abuse, okay, those who will abuse the cocaine, they'll be having the, especially this having the formation will be there. Okay, filling up small insects crawling on the body. Okay, but they'll not be exactly real swimmers will not be there here. So option number A is very right question. Okay, the filling of small insects crawling on the body is called as formication. This is seen in case of cocaine disorder. Okay, cocaine abuse, or else we can say substance abuse. So especially it's called as this is the small insects crawling on the body is called as cocaine bug. Okay, cocaine bug. So we'll go with the sixth question. So which among the following is the obstetric maneuver that is correctly matched? Okay, correctly matched. Here the examiner is asking you correct obstetric maneuver along with that purpose. Okay, option number A is Ritson maneuver. Okay, you can see Ritson maneuver. Okay, this one is asked in NORCET-9. Okay, NORCET-9 question. It is a NORCET-9 question. In NORCET-9 they ask regarding the Ritson maneuver. Okay. Option A, revision maneuver is nothing but a controlled delivery of the fetal head. Okay. Option number B is the Lawset maneuver. Okay, here they'll do. Okay, delivery of the food they will do. Option number C is Pinard maneuver, delivery of the extended arm. Okay, delivery of the extended arm. Option number D is the McRobert maneuver after coming head of the breech delivery. Okay, this all of the options are there. Okay, try to put your answer in a comment section. So all manual, okay, I'll explain all manuals. Okay, so option number A is a right answer, okay, to say. Option number A is a right answer, okay, rightly correct, okay, rightly matched answer is option number A, okay, Ritson manual, nothing but a controlled delivery of the fetal head, okay, controlled delivery of the fetal head, okay, fetal head is called as a Ritson manual, okay. So we'll see all other options, okay, what do you mean by Lawset manual? Lawset manual. So does anybody knows that, okay, in Lawset manual, sorry. In a lozenge manner, does we remove the only foot part? Okay, you can see here, okay, lozenge manner, nothing but a lozenge manure, okay, lozenge manure. So in lozenge manure, okay, especially in case of, okay, difficult labor, okay, in case of difficult labor, okay, so especially, okay, trunk will be in a lozenge manure, what they will do, this delivery, okay, this lozenge manure is done to, okay, done to deliver, okay, done to deliver the shoulder, okay, shoulder also, we can say shoulder or arms, okay, arms of the baby, okay, in case of breech delivery, okay, in case of breech delivery, what will happen after foot and all, so shoulder, okay, your arms will stuck it out, okay, so to remove that arms, okay, they will do a lawsuit manner. How they will do? Okay, they will do a gentle, okay, so you can say gentle or a controlled, okay, or a controlled rotation, okay, controlled rotation of the trunk, okay, of the trunk, okay. So what will happen, okay, in a breech presentation, foot will be a presenting part. So after foot will deliver, so you'll be having the shoulder, okay, trunk in hand, okay. So both hand you will hold the trunk and you'll rotate in 180 degrees. So in controlled, okay, gently you'll rotate the 180 degrees. So once coccyx, okay, one right angle rotation, left angle rotation, 180 degree. So one arms, okay, one arms will be coming out, okay, second arms will be coming out like that, okay. So they will do in case of, okay, obstructed difficult shoulder delivery, difficult arm delivery in a beach presentation, okay, that situation they will do a lawset maneuver, okay, lawset maneuver. Next one, okay, Pinard maneuver, okay, next option is Pinard maneuver. So if you see Pinard maneuver, Pinard nothing but the P, okay, P nothing but a popliteal. Okay, just you remember like that. Okay, P nothing but a popliteal pressure. Okay, P for popliteal pressure. P for pinard. P for popliteal pressure. Okay, remind like that. Okay, popliteal pressure. Okay, popliteal pressure. So in case of, okay, this is also in case of breach. Okay, in case of breach delivery. Okay, in case of breach in case of breech delivery, okay, to remove, especially to remove the, to deliver, okay, to deliver the, this maneuver is done to deliver the deliver the legs, okay, deliver the legs in, we can say extended legs, okay, we can say the deliver the extended legs, okay. In case of frank breech, what will happen? Extended legs. So in case of frank, okay, especially in case of frank breech delivery, okay, frank breech delivery, what will happen? The legs, okay, the fetal legs will be extended, okay, will be extended. So in this maneuver, what we'll do, in that Pinard maneuver, what we'll do, we'll extend, okay, we'll extend the legs, okay, we'll extend the leg. If it's flexed, okay, if it's flexed, not will happen, it will be fetal legs will be extended. If you give the pressure, it will extend, okay, so it will extend, okay, it will extend the legs, okay, legs of the fetus by the, okay, how will extend, by pressing over the popliteal fossa, we can say by the pressing on the popliteal area, okay, popliteal area, and just nothing but a below knee, okay, behind the knee, okay, behind the knee we are pressing, okay, we are pressing on the behind the knee, okay. So what will happen? Okay, in a breech, okay, in a frank breech, okay, the limbs, okay, the arms will be extended. Okay, so sorry, arms will be okay. In a frank, maybe what will the arms will be flexion. Okay, there will be a flexion will be there. So if you press that one, so there will be extension. Okay, there will be extension. So if extension means so easily delivered. Okay, the legs will be easily delivered in a frank presentation. Okay, in a frank breech babies. Okay, that's what your Pinard maneuver is. Okay, that's what your Pinard maneuver is. Okay, then. Next to say Pinard maneuver. Then last one, that is your Mac Robert maneuver. I think everybody is familiar is the it's very familiar with the Mac Roberts maneuver. So this one is called as like first maneuver. Okay, Mac Robert first maneuver done in case of shoulder dystocia. Okay, in case of shoulder dystocia, first maneuver is done is Mac Robert maneuver. Okay, in case of shoulder dystocia, so first maneuver fast maneuver done in a shoulder dystocia. Okay, what do you mean by shoulder dystocia? Nothing but a difficult shoulder delivery. Okay, difficult shoulder delivery. Okay, in case of shoulder dystocia, what will happen? They will do a complete flexion. Okay, complete extension. Okay, complete extension of the so sorry, like so what we'll do, so we'll extend, sorry, so we'll flex, okay, we'll flex so we know that, okay, flexion nothing but like it will reduce the angle, okay, it reduces the angle between the two bones. So what we'll do, we'll completely flex, okay, we'll completely flexing the thigh, okay, what will flex, we'll flex the thigh against the against the abdomen, okay, against the abdomen of the mother, okay, against the abdomen. So by doing the flexion, okay, just what we'll do, normally legs will be extended, or what we'll do, we'll do complete flexion, okay, complete flexion. What will happen, the angle will become reduced, okay, the angle will reduce. So what will happen though, so that the pelvic became widened, okay, the pelvic became widened, okay, pelvic here after doing the complete flexion, the pelvic will rotate, okay, pelvic will rotate. So shoulder pressure, okay. So the shoulder pressure on the baby, shoulder pressure will be relieved, okay. The shoulder pressure will be relieved, okay, relieved. So that's what, okay, that's what why we'll do. That's why we'll do the Mac Roberts maneuver to rotate the pelvic, okay. In after doing the flexion, the pelvic will rotate, so the pelvic inlet area will become large, so the shoulder pressure will get relieved, okay. So we can say it's having the, so that's why it's having the 40% success rate. Okay, so 40% success rate in a shoulder dystocia. Okay, so it will relieve the pressure on the shoulder by rotating the pelvic. Okay, so that's what our Mac Robert maneuver. Okay, first maneuver done in case of shoulder dystocia. So here if you see the options, okay, so if you see the options here, so Ritson maneuver, I told you it's very like a controlled delivery of the fetal head is the right answer. Okay, that's perfectly matched here. But if you see the Losset maneuver, will not deliver the foot here, will deliver the arms. We can say we'll deliver the arms or the shoulder. Okay, in Pinard maneuver, will deliver the delivery of the extended arm. No, in a Pinard maneuver, will deliver the legs. Okay, will deliver the legs or the foot. We can say, okay, legs, foot. So in Mac Robert maneuver, okay, it's not after coming breech delivery. Okay, it's also it's a Like it's a flexion of the, it's we can say it's a flexion of the hip to deliver the shoulder. Okay, deliver the shoulder. Okay, shoulder dystocia to deliver the shoulder will go over the Mike Roberts maneuver. So option number A is the rightly matched. Okay, option number A is the rightly matched. Okay, next we'll go with the next question. So seventh question here. So here is the seventh question. Okay, here we're having the 75-year-old male, male with chronic, okay, chronic small cell carcinoma of lungs. Okay, chronic small. Here is from onco. The question is from MedSearch. That is your onco question. So here we're having the 75-year-old male with a chronic small cell carcinoma of the lungs receiving injection cyclophosphamide. Okay, it's an chemotherapy drug. Okay, it's a chemotherapy drug for the small cell carcinoma. He's receiving the cyclophosphamide drug. Okay, after receiving the drugs, okay, the patient after receiving the, okay, after administration of the drugs, the patient will develop the hemorrhagic cystitis. Okay, hemorrhagic cystitis, nothing but bleeding from the bladder. Okay, bladder will be inflamed. Okay, so what is the preferred drug for the condition? Here the asking you the, here the examiner is asking you the drug used in hemorrhagic, drug used in the hemorrhagic cystitis. Okay, antidote or else we use it in a antidote for hemorrhagic cystitis. Okay, that is your option number B. Injection mesna is the drug of choice. Okay, drug of choice in a, in case of hemorrhagic cystitis. Okay, in case of hemorrhagic cystitis, injection mesna is the drug of choice. Okay, it's a diet question. Okay, we see the methotrexate. Okay, it's also chemotherapy drug. Okay, it's also chemotherapy drug. Not used for the hemorrhagic cystitis. Okay, bleomycin, vincristine. Okay, both all are the remaining all are the chemo drug. Okay, the remaining all are the chemotherapy drugs. So option number B, injection mesna is the right answer. Okay. Next one. Okay, question number 8. Question number 8. Okay, here we're having the like a very easy question from the foundation. Okay, from the foundation. So identify the given below breathing pattern. Okay. So we know that, okay, breathing pattern. Okay, tachypnea will be there. Kussmaul's breathing will be there. Okay. So based on the waveform, based on the picture, okay, waveform, you should answer the which pattern of the breathing it is present. Okay. You can see what is there. Okay, here you can see hyperventilation. Okay, then hyperventilation, then hyper. Okay, highest amplitude of ventilation. Then again coming down. Okay, then again lower breathing. And then apnea period. Then again there will be a slow shallow breathing. Okay, there will be increased breathing. Okay, again there will be a hyperventilation. Again there will be tachypnea. Again there will be reducing the breathing tendency. Okay, low pattern. Again there will be apnea. So period of apnea and hyperventilation. Apnea and hyperventilation are there. So based on this image, you should answer the which kind of breathing pattern it is. So option number A is Bitort's breathing. Option number B is Kussmaul's breathing. Option number C is Chinese stroke breathing. Option number D is the gasping breathing. Okay, gasping breathing. Just try to put your answer in the comment section. Okay, I'm waiting for your answers because I'm waiting for the answers. Your response matters. Okay, try to answer in a comment box. Okay. So if you see, okay, in Bitort's breathing, what will happen? So till that I'll explain the all condition. Okay, all type of breathing patterns. First option is Biot's. Okay, Biot's breathing. Okay, Biot's breathing pattern. Okay, so Biot's breathing, nothing but like it's seen in case of, okay, especially in case of head injury patient. Okay, in case of traumatic brain injury patient. In case of the, so in case of, okay, a traumatic brain injury case or a diffuse axonal injury case. Okay, or any kind of head injury. Okay, any kind of head injury. In case of head injury, what will happen? There'll be a agonal breathing. Okay, there'll be a agonal breathing. We can say agonal breathing means period of breathing will be there. Again, period of apnea will be there. Okay, especially this is due to the damage. Okay, damage to the respiratory centers in the brain. Okay, respiratory, we know that, okay, respiratory centers, they control the breathing pattern. So respiratory centers are affected. Okay, the damage due to the head injury, traumatic brain injury, diffuse axonal injury. So there will be damage to the respiratory center in a brain. Okay, that will cause the agonal breathing. Okay, that will cause the agonal breathing. Okay, agonal breathing, nothing but a Bitort's breathing. Okay, Bitort's breathing. So here what will happen? In the period of normal, okay, same level of breathing will be there. Okay, same depth and rate will be same. Again, there will be a period of apnea will be there. Okay, again the person will have the same, okay, same rate and depth will be there. depth of breathing will be there, again apnea will be there. Okay, means agonal. Okay, non-predictable. Okay, we can say abnormal. Okay, abnormal, unpredictable. Okay, unpredictable breathing will be there. Okay, unpredictable breathing patterns will be there. Okay, breathing patterns will be there. Okay, that's what we call as bitorts breathing. Okay, bitorts breathing. And then next, Kussmaul's breathing. Okay, in Kussmaul's breathing, what will happen? In a second one, that is a Kussmaul's breathing. Okay, Kussmaul's breathing, what will happen? In a Kussmaul's breathing, okay, in a Kussmaul's breathing, okay, there'll be a increased, okay, there'll be increased rate. Okay, there'll be a increased, so increase, there'll be increased depth of the respiration will be there. Okay, there'll be increased depth of the respiration will be there. Okay, increase depth of the respiration will be there. Okay, rate will be depth. Okay, there'll be a deeper and shallow, there'll be a deeper and fast breathing will be there. Okay, there'll be deeper and fast breathing pattern will be there. If you see the small breathing, okay, it's especially seen in case of DK. Okay, in case rate and there'll be increased rate and the depth of respiration will be there. Okay, so I'll draw the diagram. Okay, I'll draw the chart here. Okay, you can see. So this one is normal baseline. Okay, so increase depth and the rate will be there. Okay, increase rate and depth will be there. Okay, so this is your normal Kussmaul's breathing pattern. Okay, so here there is increased depth will be more, depth of respiration will be more, and rate also will be more. Okay, rate of the respiration also more. Okay, this especially seen in case of Kussmaul's breathing, seen in case of diabetic ketoacidosis. Okay, it's a cardinal sign. Okay, diabetic ketoacidosis cardinal sign is Kussmaul's breathing. Okay, Kussmaul's breathing is the cardinal sign of diabetic ketoacidosis. Okay, Kussmaul's breathing. Then to come, okay, third option I told you. Third option, that is your like gonal breathing finished. Okay, so we got to know like what do you mean by bitorts breathing, small breathing, and now we'll go for the Chinese stroke breathing. Okay, Chinese stroke breathing. So in the Chinese strokes, what will happen? Okay, in a Chine, okay, the term is there. Okay, Chine nothing but it happens in a Chine manner. Okay, first there will be a period of hypoventilation will be there, and next there'll be increased breathing will be there. Okay, again there'll be increased breathing. Okay, so hyperventilation will be there. Again there'll be a reduced breathing pattern will be there. Again there'll be a period of pause will be there. Again there'll be shallow breathing. Okay, again there'll be increased deeper breathing. Okay, again there'll be a hyperventilation. Again there'll be a normal period of breathing. Okay, like this means this occurs. Okay, breathing occurs in a chain manner. Okay, in a chain manner. So here there will be a shallow breathing. We can say shallow breathing will be there. Here there is a shallow, and again there will be in between there will be a peaker. Okay, hyperventilation will be there. Peaker, hyperventilation will be there. Again there will be a shallow breathing. Again period of apnea. Okay, in between there will be a period of apnea. Again the cycles continues. Okay, so it happens in a chain. Okay, it happens in a breathing happens in a chain manner. Okay, chain pattern. Okay, chain pattern. That's why it's we calling this one as chain Stokes breathing. Okay, if you see the image here, so it's happening in a chain manner. Okay, it's happening in the same chain breathing, chain pattern breathing is just option number C is the right one. Okay, Chinese stroke breathing is the right answer. Okay, gasping breathing, nothing but we can say like acidotic breathing. Okay, also called as acidotic breathing. Acidotic gasping, nothing but acidotic breathing. Here the person will be in a severe respiratory or metabolic acidosis will be there. So the person will be using the extra muscle. Okay, will be using the extra muscle. Okay, or extra muscle for the muscle for muscle for the respiration. Okay, muscle for breathing. We can say muscle for respiration. Okay, that's what we call as a gasping breathing. Okay, so option number C is the right answer. So with the eighth question, okay, we'll finish our today's session. Okay, now we'll like wait for the tomorrow. So tomorrow again we'll be coming with a new question from the all different subjects. So all your high yielding topics is covered here. Okay, we'll do a rapid revision until the NORCET 10 will come. Okay, thank you all for watching. Keep on learning, keep on studying.